So this next video then will help you with Unit 6, which is responsibilities of the care worker. So to meet assessment criteria 1.1, you've got to explain how a personal relationship differs from a working relationship. So the key term there is explain. So you've got to explain the difference. So give a definition of what a personal relationship is, and give a definition of a working relationship, and then explain how they differ. So we know that a personal relationship is based on that foundation of love, of that trust for one another. You form an interpersonal bond because you've got similarities, or you're in that same circle of friends. So you've got same social sort of like experiences or similarities. Whereas a working relationship we know is formed based on certain policies or procedures or certain work ethics that you both have to comply with. So there's a lot of differences between a personal and a working relationship, and you've got to define the two and then explain the difference between. 1.2 asks you to describe the different relationships in your own care setting. So what I want you to do for this one is have a look at the different people you work with on a day-to-day basis. Think about the different professionals you come into contact with. What kind of relationships have you got with them? And what sort of basis is that relationship formed on? So for example, you work on a day-to-day basis with your colleagues, other carers, senior carers, your manager. You may come into contact with your district nurse, other professionals that are external that may come in, like social workers, doctors, dietitians. So all these people together we work in partnership with, but we have a different relationship with them. So you have to describe the type of relationship you have with them. So my advice would be to look at the professionals you work with, think about how you work with them on a day-to-day basis, and describe how they help you in your work role. 2.1 asks us to describe why it's important to adhere to your own job description. So we know that in Unit 2 we looked at your own job role and your responsibilities of your own role. But for Unit 6 we need to look at why it's important to follow and comply with your own job description. So we're going to describe the reasons why. So what you need to do is look at why you follow your own job description. So your job description forms part of your contract of employment, and we must adhere to that at all times. To comply with legal obligations, to follow internal policies and procedures, and to make sure that we're not doing anything outside our own role and outside our own professional boundaries, that we're working within our own limitations. By doing that, that prevents any allegations, it prevents any litigation against yourself, and it makes sure that you're doing everything that's expected of you by your employer and of the job that you're employed to do. So just give a description of why we follow and comply with your own job description. I don't want you to describe your job role. What I want you to do is tell me why it's important to follow that job description. 3.1 asks you to explain why it's important to partnership work with others. So we know that partnership working is that collaboration between teams, working with others outside our own areas of expertise. And by effectively partnership working, that allows us to draw on the other experiences that people may have, to share their knowledge, to share information. It allows us to use their skills and expertise above and beyond that of our own role in order to meet the best possible care needs for that individual and provide that continuity of care. So what we do is by partnership working with others, whether that be a social worker, a district nurse, a GP, it allows us to share our own ideas, draw on their expertise, their skills, their knowledge, share best practice, and work together in order to provide that best possible care for that individual. So 3.1, just explain why partnership working is important. Why do we work with those other professionals that you've already identified? 3.3 asks you to identify the skills and approaches needed to resolve conflict. So what I want you to do is have a look at a particular situation that you've dealt with in the past in your work practice, whether that be with a colleague, a resident's family, or a resident themselves, where it was particularly conflicting, where there were a dilemma and you had to deal with it. What skills, what approaches, what techniques did you use in order to diffuse that situation and manage it well? Now you're going to remain calm at all times. Try to negotiate if it's between two people and not that of yourself. Look to compromise in order to diffuse that conflicting situation. Now seek some additional advice. No one's expecting you to know how to deal with that situation. It may be something you've never dealt with before. If it's a lack of understanding about a particular person's needs, go and read that care plan. Give yourself better information. Equip yourself with them skills and knowledge to be able to deal with that conflict should it arise again. But look at a conflicting situation. Tell me the skills you use in order to manage that. Be mindful of confidentiality if you are going to use a real life situation. Don't give anyone's names, but tell me what you did in order to make sure that that conflict wasn't perhaps a challenging situation.